And this should just be me talking. Can you make that smaller and make me larger so that's there so we don't lose it?
I can't adjust that because it's your file.
Okay.
But leave it open in the background.
Yeah. And how can I make myself bigger?
As in, I'll do that when you start talking. Then.
Yeah. So if they see me bigger and then they just have that in the background, that's fine. And then when I'm going to start the slides, if you just make me smaller, can you do that?
I think that'll just happen automatically anyway. Yeah.
Okay.
Yeah.
I mean,
the power. I can make you bigger and smaller, and
it's magic.
Okay. Are you ready to get started?
I'm ready to get started. Yeah, I think, yeah.
Okay, excellent. So if you want to stop share, then.
So stop share. I thought we were going to leave it in the background. No?
Can I do that, Liza? I wonder.
Liza?
Don't worry about it. Are you is it to show the introduction video?
Yeah.
No, don't worry, Katrina. Most of the people on here have already seen it because they've been in the previous presentations today. So rather, if Angela's is working, then rather just leave it as it is. We don't want to interfere, and then it doesn't want to work. So that's fine. Don't worry about that other video. That's not a problem.
Okay. Okay, so let's get started. So you're very welcome, everybody, to this evening's presentation with the fantastic Angela Telford. This is foot reading for fertility. So a little background about Angela. So Angela is based in the UK, has been a therapist since 1987 and a reflexologist since 1992. So she began studying the significance of the appearance of the feet about 10 years ago. She calls this visual reflexology to distinguish it from other ways of foot reading, which predominantly uses modalities besides reflexology. So Angela has been teaching CPD workshops in visual reflexology for over 8 years. She also works with schools in the UK on a consultancy basis so they can implement these modules into their diplomas as well. She's written a book on the subject called Visual Reflexology and Foot Reading. If you don't have that book, I highly recommend it. It's fantastic. She provides lots of free resources for study on the subject within the reflexology community as author of the open access visual reflexology blog, Feet of the Month, and the Visual Reflexology Facebook group, which is a fantastic group where you can upload pictures yourself to get more insight into those feet. It's a really good Facebook group. So as well as her visual reflexology work, she continues to work as a reflexologist in London. This presentation this evening is on reading the feet during adulthood, specifically during preconception, looking for visual indications as the reflexes of issues that may be a challenge to successful conception, and also potentially carrying to term for the lady. I'm just going to start off with a brief synopsis on the theory behind visual reflexology, and then she's going to show us lots of slides and go into plenty of detail. So without any more delay, Angela, I'm going to hand it over to you. You're very welcome.
Hi, good. Thank you, Katrina. Katrina has been so supportive of me throughout my career of developing visual reflexology. So I'd just like to thank her for that. She's been great. So it's lovely to have her introduce me. As she said, most of this presentation is going to be slides. It's not actually going to be my face you're going to see in the big screen. I will be talking you through the slides, but it's mostly me going to be showing you lots and lots of slides of feet to illustrate the subject matter that I'm making the presentation on. Now, I just want to say before we start, it's really important for me to say that tonight I'm only using the presentation to describe how we can assist women pre-conception. But as I think we all know, it's equally important that we treat men. Unfortunately, we don't see them anywhere near as much as women. But problems with fertility can be equally to do with men. They can be a third to do with women, a third to do with men, and a third to do with both parties. But unfortunately, it would probably take a bit too much time tonight to do both sexes, but there's two reasons why I just chose women. Well, three really. One, because we mostly see women. Two, because when the things that I'm going to show you tonight, how to read the feet to assist women for fertility, really pretty much are the same things that you can use to assist them when they do actually conceive and to help them carry it to term, which of course that's not relevant to the man. And the third thing is that in reality, there's not a great deal of difference if you're treating men. Obviously, the reproductive organs are different, but other than that, on the whole, we're just talking about how you treat a human being. So as I said, I'm going to refer to women, but hopefully by the end, you'll be able to understand how you could use it on your male clients and also use it to carry on with a woman as she goes through to term. So that's just a bit of an introduction. And we'll have some question and answers at the end. I'm not sure how long they'll go on for, depending how long it takes me to get through the slides. We're not going to have any questions and answers through the session because I find that it's too, the way that I'm going to do this presentation, it's too disruptive. But at the end, hopefully some of you will have some questions and I'll be able to answer them. Katrina's going to take your questions for me. I'm not going to take them. She's actually going to take them because, as I say, she knows the subject so well, and I'm sure she'll do a really good job of taking the questions for me. And I hope you've got lots of questions. Maybe you've got some already. If you haven't already, then you've got some for after you've seen the presentation. So the first thing, there may be some of you out there that don't know what foot reading is. I just briefly describe that it's really just looking at the feet. We all spend, an hour at least with the feet in front of us. And unfortunately, for some unknown reason, I'm not really sure why, foot reading has always been seen as a bit of a side event, something you might do out, you're particularly interested for CPD or whatever. But to me, it's strange that we don't use it a lot more. And I think we will in future. And lots of schools are starting to incorporate it into their basic teaching, which is fantastic, because after all, if the feet are in front of us, why are we not using what we can see on them to help us with our treatments? I'll explain a little bit more in a minute about how and why we can do that, but that's fundamentally what foot reading is. Everything and anything we see on the feet is helping us, it's giving us greater insight into the health and well-being, physical and emotional, of our client. Now, I really want to explain quite a bit about the difference between visual reflexology and other forms of foot reading. Katrina just touched on it briefly there, but I know lots of people all over the world have studied with other great foot readers and they've learned a way to foot read, which, I myself, I've studied with many foot readers and many ways of reading the feet. But when I started looking into it, really, I didn't quite understand what the reasoning was behind a lot of it. And as I got more and more interested in foot reading, I really wanted to know what the reasoning was. And when I looked into it properly, what I came to understand was that all those other ways of foot reading are based entirely or substantially in other modalities. They're based in the chakras, they're based in yin yang, they're based in meridians, they're based in the elements, earth, air, fire, water. And as I said, they're all great, they're all very relevant. But I was like, why, we are the feet people. Why do we not have our way of reading the feet? Why are we using these other modalities when we haven't developed our own? And, I think probably all of us here learned Ingham method reflexology or something very similar. And that is based on the physical reflexes. And certainly myself, I felt I didn't really have enough knowledge or understanding of those other modalities to really comprehend how the reasoning was coming to make those decisions. And I really wanted to use my existing knowledge of the physical reflexes and Western anatomy and physiology to be able to read the feet. I thought surely there has to be a way. And also at the same time, I thought, well, it's going to be a lot easier for other reflexologists, certainly a lot easier for students of reflexology, and even, people who are just practicing at home with family and friends who haven't got a qualification. to understand how to foot read and why to foot read if they understand the reasoning behind it. And what I've always said about visual reflexology is it's not a technique I'm teaching anybody. I'm just allowing people to develop their skill, develop their eyesight and learn how to read the feet for themselves. But the best way to do that really as a reflexologist is to learn how you can really incorporate it into your treatment and learn the knowledge you've already got, which is based on the physical reflexes based on Western anatomy and physiology. Now, what I found, just briefly going back to other forms of foot reading, is now that I know visual reflexology alongside them, there's really not any conflict. And those of you that have studied with other great other teachers of foot reading, as you get to know visual reflexology yourself, will come to understand it's just different ways of reaching the same goal, which is to help and assist our clients. But for me, it's been amazing to find a way that I can actually read the feet without needing to have any knowledge of any other modality. And it's given me much, much greater insight to my work as a reflexologist, to be able to read the feet and understand why they're showing us what they show us, and bring that together with my palpation, with my touching the feet, and of course what the client tells us. So that's really the main difference between reflexology, visual reflexology, and other forms of foot reading. But there are a couple more things. The next thing is that, you would never use visual reflexology standalone. You would never just see somebody to read their feet, which I know other foot readers do. You would never use it to kind of just give an assessment of their lifestyle, give them life coaching, give them counseling, which other forms of foot reading really do a lot of that. You would always give it within a reflexology treatment, and you wouldn't use it to diagnose emotionally any more than you'd use it reflexology to diagnose physically. You would use it to encourage the client to find their own self-healing within them. You didn't use it to encourage them to talk about their emotions, so on and so forth. But you're not using it to give counseling. You're not using it to give any kind of therapy any more than you're using what you use what you feel in the feet. So that's a big difference. I think that's they're the main differences really, that it's used in quite a different context to other forms of foot reading. So I want to really now talk a little bit about what its uses are. What are the uses of visual reflexology? How do they actually come into play when we're giving a treatment? Now, the first thing is, for me, it really guides me in how to give a treatment, because if you can look at the feet and you can see things, for example, if you see areas of inflammation where the skin's very red, the cells are very red, sorry, that tells you straight away you need to spend more time there. If you're seeing areas, for example, say over the lung, typically you might see very dry skin, it might be slightly yellowish, you need to spend more time there. So it helps me allocate my time in a treatment, which for me is really important, because it's kind of funny that the longer I spend doing reflexology, the more sensitive my fingers get. And it's funny because I actually sometimes find it harder to allocate my time to each part of the foot, but it really helps me decide what I need to focus on. It also helps me decide what techniques to use, because I would use a very different technique if I'm seeing hard skin to, for example, say if I'm seeing lymphatic, puffiness. If I'm seeing muscular tension, I would use more of a massaging technique, for example. So I will talk a little bit more about that as I show you the slides. But for me, it really helps me with the way I would work on the feet. It also really helps me with the questions I ask of clients, because often, as we know, there's many, many, many reasons why clients don't give us a full and accurate reading of how their health is. But if I'm seeing an area, there's a lot of broken veins, broken capillaries or something, I say around the lower back reflex, the client's not mentioned any problems they've ever had with their lower back, they may have forgotten, but it will lead me to ask more questions, and chances are they might go, oh yes, and certain things might come up. I mean, pertinent to this presentation, for example, often when a woman's had a miscarriage, or sometimes a C-section, but very often miscarriage, there will be a lot of broken veins along the area around the uterus reflex. And it may be something that she's almost just pushed the back of her mind. You know, she doesn't, you know how we bury those things. And, you know, she may then, you know, find she's able to talk about it, or, you know, I will at least be able to ask her if something happened there that, you know, you've missed or you want to tell me about. So it's very useful to help trigger memories. It's helping to draw things out of clients. So it's useful for that. It's also useful because you actually see the energy of the entire person, because when you're looking at the 2 feet together, you're looking at the whole person. Now, when we palpate, when we work on the feet, we tend to be very micro focused. We're working on very small areas of the feet, usually. We're maybe working on individual reflexes, and that's all and good. But it's not really giving us an idea of the person as a whole. But if you're looking at the 2 feet together, you're really tuning into their whole energy. And when you start to do this, you will start to realize just how different feet are. It is quite remarkable, but you will get such an idea. You will be able to pick up how that person is from the minute you start looking at their 2 feet together, rather than, you know, talking to them and then zoning. You know, okay, you might do a little bit of introduction, general massage, but then, you know, you kind of get into your routine. The more time you spend, now I'm not saying you spend 10 minutes, but, you know, spend time looking at the feet and get an idea of the energy of the person. It's really good for that. And as part of that, you get a very good idea of the left-right balance of the person, because obviously the left foot's telling you the left side of the body and the right foot. And again, you don't tend to get that when you're doing the microcosm. So it gives you a much better idea of the macrocosm of the person. And the difference between the 2 feet, which again, the more you look, the more differences you see. And that's telling you how people have adapted to changes in their life, physical, emotional, the difference between the 2 feet. You know, that's telling you straight away where there's imbalances in the 2 sides. Again, you won't get that from working very closely on individual reflexes. So it kind of takes you out of that just focusing on specific small areas and into looking at the person as a whole. And it also, that sort of brings me as well to one of the ways that very much we would read the feet with visual reflexology, which is you're looking really at the systems of the body. So when you're looking at the whole feet, for example, you might see inflammation over an area. You may just see it over a reflex, but much more likely is you will see it over an area, because after all, if there's problems with the system in the body, it tends to not just affect one organ in isolation. It will, you know, influence, it will affect everything around that organ. It'll affect the muscles, the joints, the lymph, the nerve, everything around that area will be influenced. So it teaches us really to look at areas of the body as well, not just focus, as I keep saying, on the individual organs and so on and so forth. We really are looking at the systems and how the systems are functioning. And that is one of the ways that it helps you to actually decide what techniques to use, as I mentioned earlier. So it's very useful for that. It really is also very, very good when you're working on the feet, because you can see changes instantaneously. It can help you. It can help you see how efficient, how effective your treatment's being. And I'll just give a simple explanation, a simple example. If you're seeing feet that are very, very tense, extremely tense, when you work on the first foot, you will straight away, hopefully, you will start to see that foot relax. The muscles, the joints will relax. That's visual reflexology. You're already using it to some extent, you know, maybe without not even thinking about it consciously. Then you go to the second foot and that will still probably look pretty tense, but then you work on that, that will relax. So that's a very simple example, but there's lots of other examples. You know, you see the color change, obviously, as the circulation improves, things like that. There are other things you will see between treatments as well. You will see a lot more changes between treatments once you start actually looking at the feet at the end and taking notes of what they look like visually between the beginning and the end, and then the next time the client comes to see you. It really helps you trigger your memories of how things were. It's really good to add it to your note taking as well. And it's also, if you haven't seen a client for a long time, it's a great way of refreshing your memory and seeing how the feet have changed, because the feet really are talking to us. They're really giving us so many messages, and if we don't listen to those messages, we're missing out on so much. Also, I want to say, for me, it's really helped me get back in touch with using the zones, because I kind of had, well, obviously I'd learned the zones, the 10 zones, as we all do, but I kind of lost touch with them a bit, because the way we tend to do sequence is not really focused on the zones. It works in in a different way. But using visual reflexology has reminded me of just how important the zones are. And one good example of that, for example, if you're seeing a problem with one of the toes, the one of the toes might look very different to the other 9 toes. So that's telling you something, not just about the organs, the reflexes that are found in that toe. It's also telling you to pay a lot more attention, palpating down that whole zone. And that may give you a lot more information about what's happening. It may not be immediately obvious. It may not be, the problem may not really be, the client may not be talking about the head having the problem, but the problem may be further down that zone. So it's helped me get back in touch with zones. Now, I have to say at this point that we also use the dorsal a lot. When you are looking at the feet, if you can't see the dorsal side of the feet in front of you, get up before you start and have a good old look at them and really take note of what's happening there. The dorsal side is so underused. It's such a shame. It's really, really such a shame. And the energy goes through the body. It goes anterior, posterior, and vice versa. It goes through the feet, dorsal, plantar, and vice versa. Often we'll see things on the top of the foot that actually are telling us what's happening, the interior of the foot and the plantar foot, the inside of the body and the plantar foot. For some reason, there's a mark on the dorsal side, or there's distended veins, whatever. You see them on the dorsal side, but they're giving you a lot of information about the internal and the plantar. So you're seeing already that don't just look at the plantar. I'm looking at what's going on between the two. And of course, the energy also flows up and down from the feet up to the body and back down again. But with visual reflexology, it is so important to look at the dorsal. And I will give you some examples of that as we start looking at the slides. And there's one other thing I want to stress very much before we go any further, because I know we've got people from all over the world watching this, which is great. And I know that we all learn with different teachers, different schools, and we are taught that the reflexes are in different places. A lot of the reflexes are in different places. Now, one of the nice things about visual reflexology is that it doesn't really matter if we disagree, because visual reflexology takes us back to the basis of our therapy, which is just to help balance the body. So it doesn't matter if we're in disagreement, we're seeing an area of yellowness over a certain part of the foot indicating toxicity, for example. All we need to know is the yellowness is telling us there's toxicity in that area, and we need to work to remove toxicity. Whether we agree or disagree, what organ, what joint, what area of the body it relates to is almost irrelevant, as long as there's no contraindications, obviously. But other than that, we just look and we work with what we're seeing, and we use that in conjunction with what we're feeling, and we don't need to know anything more ultimately while we're with the client. Outside of when we're with the client, we can discuss till the cows come home what we think is where, and the visual might actually help us get a more definitive map of the feet. But I mean, that's another discussion. Now, the last thing I want to talk about in terms of what uses it has, and again, this is really, really important, is take photos, especially if you've got a challenging client. And that may well fit into this category again, because you may well be treating a woman who's been trying to conceive for a very, very long time and, just not getting anywhere. And you yourself, you might have been treating for a while and not getting anywhere. If you take photos, always with the person's permission, always take photos of the plantar side, the dorsal side, that lateral and the medial, particularly important for reproduction, obviously. And have a look at those photos when you're not with the client. They will give you so much more information. You know, the visual is very helpful when we're with clients, but it can be difficult to really focus on it a lot of the time because we're focusing on our palpation. The client may well be talking to us. We've got our own distracting thoughts, you know. But if you take photos and then you go away and you look at them, and always, I have to say at this point, take them in a good light. Take them before the treatment starts, because you may well, you know, very likely you're going to dim the light so the person's relaxed. Take them in a good light, have a look at them when you finish the treatment, and a lot of things will become a lot clearer, and you will get a lot of information to take back with you the next time you treat the person. So photos, really important and really, really useful. So right now, moving on. What do we read when we're looking at the feet? We read everything. You know, there is nothing, absolutely nothing on the feet that is there randomly. Nothing came down from heaven and landed on the feet. Nothing. Even if something landed on the feet, that still is showing us something, that the foot had trauma. So it's all showing us something. What we're looking for, we're looking at lines, we're looking at underlying skin tone, we're looking at skin texture, we're looking at underlying tissue, so dips and swelling, we're looking at broken capillaries, we're looking at swollen veins, we're looking at muscle alignment, we're looking at freckles, we're looking at moles, we're looking at marks, we're looking at the condition of the nails. You know, if you see it on the feet, it's telling you something. So we're looking at all these things. Now, what are all these things telling us and why? Well, when we go through the slides, I will cover that a lot more, exactly what all these things are telling us. But what's really interesting, what I found out as I was researching all this stuff, was that actually, and a lot of you may already know this, all the systems of the body are represented in cells in the skin. And I'm going to show you a slide in a moment that illustrates that. When there's changes to those cells in the skin on the feet, that is telling us there's been changes to the equivalent cells in the body. It's that simple. And that's the biology of it. If we accept as reflexologists, which we do, that each area of the body is represented in a part of the foot, if there's changes to the cells in the body, there will be changes to the cells in that part of the foot. That's why a freckle will develop on a toe and it's not developing on a heel. You know, you have to ask yourself constantly, even if you don't know the answer. And I'm not saying I know all the answers. There are so many things I still don't know why we're seeing them on the feet. All I know is I want to find out why something's where it is. Why is the verruca there? Why is it not somewhere else? It's because there's been changes in the cells, that part of the body. Now, even if there has been an incident and it's caused something ectopic, say somebody stood on a nail, okay, that's not coming from internally. However, the response of the foot, of the skin to that trauma is still telling you about the health of that part of the body, how well it responds. That's telling you about the health of that part of the body. So every single thing you see, it doesn't matter if it's because the foot's rubbing against the shoes. If it's rubbing against the shoes, that's telling you about the gait, the way the person's walking. That's why the hard skin's building up. You know, it's not the shoe. The shoes might be the wrong shape, but it's because the feet are rubbing against the shoes because of the gait of the person. The gait might be changed because the shoes are changing the gait. Nevertheless, the gait is still changing. Or the gait might be because the person is just walking in a certain way, and that's causing the feet to rub against the shoe. But, you know, the amount of time people will say, oh, it's just hard skin because it's rubbing against the shoe. Yes, but why is the foot rubbing against the shoe there and not somewhere else, or not on the other foot, only on one foot? So you see, I kind of drive myself and all of the reflexologists slightly mad by wanting to find out why things are happening at every reflex. And this is the best, you know, this is, and I think this is as far as I'm going to get, and this is far enough for me to know that all the systems of the body are represented in the skin cells of the feet. And when we see changes there, we see changes in the body. That's what it's reflecting. So I think that's more or less it. The last thing that I want to say before I start the slides is that one of the most fascinating things of visual reflexology for me is that although I look at the feet very much, I'm a bodywork therapist, holistic bodywork therapist, yeah. So first and foremost, I always look at the physical, and then I think about the other energies, yeah. Now, the visual, you see how clearly all the energies are represented in exactly the same way. They all replicate, and I've already given you some examples, but I'll just repeat one. You know, if you're seeing inflammation, say you're seeing inflammation in the heels, very important if the woman's trying to conceive. You've seen inflammation there. There's inflammation in the cells in the foot. That means there's inflammation in the pelvic, the cells in the pelvic area. But it means she has inflamed emotions regarding that area of her body. So it means she might be feeling irritated. She's probably feeling angry. And you have to ask yourself, and then if it's possible, if she's willing to talk or wants to talk, you can maybe get some idea of why she's feeling angry. Is it something to do with her partner? Is it to do with, you know, lots of other things? Even her relationship with her parents can actually be a major force in, you know, emotional problems. And as we know, as holistic therapists, emotional issues can really, really come into play when you're talking about fertility. And I would say that going back to what I talked about at the start, that we're not there to diagnose. We can really help make a safe space for the woman to talk and open up and so on and so forth. But I would say as a reflexologist, and certainly with visual reflexology, sometimes there's times when you just think, okay, this is a good time to refer the person, or make a suggestion rather, that they might want to go and see a counsellor, a qualified therapist, maybe a couples counsellor, or maybe a bereavement counsellor if you feel, you know, they're grieving for their mother and that's affecting their, you know, I mean, that's a bigger picture. And as reflexologists, I'm sure you're already conscious of how you would refer to other therapists within your practice. So reflexology gives you other clues as to times when it might be good to refer to other therapists, and I'll talk a little bit more about that as the slides progress. But what it is amazing just how holistically everything replicates. I mean, hard skin, as I just mentioned, that's a shield, that's a protective shield. So there again, if you're seeing hard skin around the heels, that's a protective shield. The person's trying to protect themselves. What are they trying to protect themselves from? And so on and so forth. That's as you know, if you have done other forms of foot reading, as I say, there's no conflict with them because you will tend to end up with the same sort of answers. But the way that I read the emotions is very much based on, I'm sure a lot of you have heard of Louise Hay, her way of looking at, I think it's called metaphysical health, where, you know, it's exactly this kind of thing I'm talking about, which is, you know, it's universal really. It's just maybe looked at in different ways with the chakras or other modalities. But that's the thing with visual reflexology, and that is one of the things that I love about it. I find it amazing that actually, as a physical bodywork therapist, if I understand the physical, then straight away I'm getting more insights. I'm actually getting more insights than if I didn't understand the physical. So that for me, it's, you know, that's a massive bonus. Okay, so I think that's the introduction. So I'm going to start with the slides now, and I think, Katrina, are you going to make the slide, make me smaller? Was that what's going to happen? Or can you see the slide?
I can still just see you in the spotlight, and I can see your screen bigger at the moment. So
okay. Can you see the slide in the background?
Yeah.
Okay. So can you shift me off to one side, or is it visible, the slide?
Can everybody see the slide? can you make the slide slightly bigger? Can you,
I mean, it should really be big enough.
I can see that anyway.
Yeah.
Yeah, if you can make it bigger, great. But if not, I think everybody can still see it, Angela, and we can see you. We can still see you.
Okay.
That looks good.
Okay. Okay. Great.
Yeah. Good.
I just now, because you're all in. Okay. I think I can. Yeah. Yeah.
Now
yeah.
I think if you just go left and right, you should your
Yeah,
other
because
pictures
you're down the side. I couldn't see the
Yeah.
arrow to move this anyway. So hopefully, fingers crossed, we're okay now. So
Okay,
this is so please, anybody, if you're having any problems, do try and communicate with Katrina. But hopefully there won't be any problems with anything you're seeing. So I've got, as I mentioned, I've got the first slide, which is just showing you the skin and how the systems of the body are represented in the skin. Some of them more directly than others. You know, I mean, you've got, for example, you've got the lymph, you've got the muscle, you've got capillaries, you've got the arteries, you've got the nerves. Some are more indirect. I mean, the melanocytes, for example, they can be very indicative of problems with the endocrine system because moles can develop at times of hormonal changes, things like that. It's a bit long to go into the biology of it all, and I'm not necessarily the best person to go into the biology of it all. But, you know, as Katrina mentioned, I do have a book, and in the book I go into a lot more detail, and it's all very simple, it's all very straightforward about, you know, how the biology works, but it's not really that relevant. The main thing is for us to understand that this is what's happening. And when we're seeing changes to the cells of the skin, although some of these might be deeper, they're not on the surface, they will impact the appearance of the surface level of the skin. So I hope you've all got the gist of that, because that is very, very important. At the end, you can ask me questions if that's not clear to you, but that is really the basis of what I'm talking to you about today. Okay, so now we're going to move on to the first slide. So everybody see that next slide of the feet, Katrina? Yeah? Can you see slides of the feet? Great, brilliant.
Yeah, if anybody has any problems seeing anything, maybe just put it in the chat box first. I can see it perfectly.
Okay, if it's too small or whatever, please. There will be varying sizes. I mean, it's just how they've come out, but hopefully, you know, they're all big enough for you to see. So we're starting with the musculoskeletal system. Yeah, there's arrows on some of these slides. It's just to help make what I'm telling you a bit clearer, so I don't have to go on for so long. I'd have to waffle on for so long. Now, when the person lies down, when they present in front of you, as long as, and this is majorly important, as long as they are properly supported, so they've got support under their ankles and their knees, and they're nice and relaxed, the feet should be in this position. Sometimes people have this idea that the feet should be straight. I hope you can all see my cursor. The feet should be straight like that. No, they shouldn't, because the muscles of the legs are heavier, particularly thigh muscles. They're heavier. The lateral muscles are heavier, and they cause the legs to roll outwards if the person's relaxed. If the legs and therefore the feet aren't rolling outwards, the person is holding tension, whether that's chronic or acute because they're a bit nervous. That's the first treatment. They don't know you, all that. The legs are holding tension, and that is reflected in the feet, and particularly in the ankles. You cannot have the feet in the correct or incorrect alignment unless the ankles are involved. The feet cannot, the rest of the feet cannot operate without the ankles. The ankles are the ones that are doing the mechanism here of the alignment of the feet. So this is pretty much, I mean, you're never going to see perfect, obviously, but this is pretty much how the feet should appear. Straight line going up through the body. They should appear roughly at 11 o'clock and 1 o'clock, and they should be about equidistant from the line, and they should lie at kind of hip width apart. And by that I don't mean the thigh, because you know, some of us, you know, we have quite large thighs. I'm talking about not the thigh muscle, I'm talking about the joint, the thigh joint. So it should roughly be like so. Why this is important is because, quite obviously, if there's tension in the ankles, there's tension in the pelvis, and that's where we're finding the reproductive organs. So you want to see feet that are nice and relaxed, and most importantly for reproduction, open. They've got to be open to their partner on every energetic level. You know, they've got to be open psychically, they've got to be open emotionally, they've got to be open physically. Everything's got to be open to new life. Now, I'm going to show you some examples of where the person is presenting and they're not open. And here we go. So you can see here the difference. I'm just going to quickly flash back to the previous one. Look, nice and open, closed off. Very simple comparison. This person looks, when you think about it, they're protecting something. They're really closing in. And you know what I said before about the visual, the physical overlaps with the emotional, with the mental. This person, this body language of this person, they're protecting themselves. And it was interesting because one of the things that actually really made me want to learn more about foot reading was when a client of mine turned up and she presented similar to this. She'd never presented like this before. I hadn't seen her for a while, but I knew she was trying to have another baby. And I said, oh, you know, you're still trying to have another baby. She said, oh, that's why I've come to see you. She said, I've just miscarried. I thought, she's miscarried. And that's why she's presenting like this. She was protecting. What have we got here? We've got the ovary. Sorry, not the ovary. We've got the uterus. She's protecting the uterus. And also, of course, the heart, the chest area, very emotional here. She's closing off, she's protecting herself. Now, that's naturally what the body does in crisis mode. You do. You make yourself smaller, close off, protect yourself. But that has to pass. You know, she has to let go of this. And that's where we come in. We have to work with this kind of presentation. And I'm going to show you this kind of presentation from the dorsal side. So remember what I said earlier about, you know, look at the dorsal. The dorsal is very important. Here we see similar thing. The woman's closing off. And we can see here, what we can see here, we see the fallopian tubes. Very useful. And you can see there, I hope you kind of get that. But even if you can't see it, you'd be aware. There's a lot of tension in that tendon or these tendons to pull the foot in that way. And what reflex have we got across here? The fallopian tubes. And I think, thankfully for this presentation, I think pretty much everybody agrees on most of the, you know, the reproductive placements for the, you know, the reflexes. So yeah, so this is already, you've got a barrier, you've got a physical barrier, and you've got emotional, psychological barrier to the egg passing along the fallopian tube. So what can you do? This immediately tells you straight away, if the woman's presenting like this, you know, there might be all sorts of things you could ask her about, emotional as well as physical, but that's, you know, that's part of your job, part of your treatment. But in terms of technique, I wouldn't start. What I would do with people, women present like this, I start on the heels. I do a lot of holding, a lot of try and make the woman feel safe. I would always cover the woman up, always, always. If there's any idea at all, there's anything like that happen. But I think it's a good idea with fertility anyway. Cover the woman up so she's not exposed. Front of the body, the uterus, the ovaries aren't exposed. Cover them up, even if it's hot, just a light sheet. But looking at this, you want to make the woman feel safe to open up in your presence. And hopefully, you know, you do a lot of very gentle, caring work around the heels, around the ankles. And even within one treatment, you will hopefully start to see the feet open up. And within a course of treatments, you know, they might regress slightly. She might come back second, even third treatment, and she's still closing off. But hopefully, gradually, she's coming, she's presenting a lot more open. Now, I'm not saying that in itself is going to be enough for her to conceive. I probably should have put this thing at the beginning or before we started the slides, but with reproduction, you know, you're going to have multiple reasons why a woman can't conceive. A lot of the times she's not been diagnosed with any particular problem. It's called subfertility. It may not be one major issue. There may be multiple minor issues that are all combining to prevent her conceiving. Even if she has had a diagnosis of one particular thing she's been treating for it, there may still well be other factors. We know as holistic therapists, you know, there may be multiple factors. So, you know, we just want to do what we can with what we see and just help her increase her chances. And this leads me to the next thing I want to say about firstly referrals. I'm going to move on and show you some more problems with misalignment, because in terms of referrals, you can see here how closed off, you know, this person's just kind of going like, go away, you know, that's the body language. I mean, that doesn't look like a person who's open, receptive, and ready to conceive on any level. She's not even open to the treatment, never mind anything else. So, you know, this is the kind of thing to look out for. And when you do start working around the heels, you may well find, oh, you know, there's so much tension around here. And there may obviously be a major physical component, not necessarily just emotional. You may well feel, I'm going to move on and show you some more examples, like this, for example. This looks to me primarily, it may well be a physical misalignment. That's why I've got the arrows there to draw your attention. You see how this foot is actually higher than that foot. So this is telling me there's a slight pulling forward on the pelvis on this side. Actually, probably quite a large pulling forward. I hope that makes sense. Sometimes when I'm doing workshops, I tell people to do these things with their feet themselves. If you pull forward one foot, then the hip and the pelvis tends to follow through. And so again, very relevant for the ovaries, fallopian tubes, and the uterus, all organs that are held in the pelvic girdle. So what I was saying, I'll go back to it, about the musculoskeletal system. Reflexology can really, really help with this. It's really great, but you may feel you want to speed things up slightly. So do possibly what I've done over the years quite a few times with really quite a lot of success is refer to a chiropractor or an osteopath, and they may just be able to speed things up. And for a lot of women, that's very important. You know, they may feel time's running out for them, or they may have been trying for a long time, or, you know, various things. And also, if they do end up in a position where they may realize, oh, I need, you know, it would be a good idea to have osteopathy. It's really good for them to have osteopathy before they get pregnant. You know, it's much better for the body to be in a settled state, not having all those hormones changing and ligaments loosening, all that when they're pregnant. So it can be a time when it's really useful to refer. And actually, you know, osteopaths and chiropractors know how important it is, how important pelvic alignment is, because you're impacting the blood supply, the lymphatic supply, you're impacting on the nerves, so many things that are going to help the woman not just conceive but also carry to term. So you can even find osteopaths who specialize in osteopathy for fertility. If you can find one in the local area, then brilliant, you know, because it, as I say, it can really help. And sadly, the medical profession doesn't really seem to acknowledge the role of pelvic alignment in fertility. Maybe it's because, you know, as I mentioned before, there's so many contributing factors, and some women that actually have got, you know, serious problems, serious lower back problems, conceive, carry to term without any problems. Whereas another woman who's not even aware she's got a back problem, it is a factor. She's just not aware. She doesn't have any symptoms, but you know, you will treat her with the reflexes and she'll conceive. You treating the musculoskeletal system, or you send her to an osteopath and she conceives. So that obviously has been a factor. So I don't know why the medical profession doesn't really, you know, recognize its importance, because it's not woo-woo, you know, it's, as they would put it, there's nothing really hard for them to understand, but they don't seem to. Anyway, so I'm going to show some more examples of what you can look out for. Here, this is more, I would say, a horizontal, where one hip is higher than the other. You can see there, the foot, it looks higher, but this is at the same level. So she's actually pulling away on one side. If you, I hope that makes sense. You know, so it's a kind of like horizontal tilt to the pelvis. So next thing, yeah, this is where the whole pelvis is kind of shifting to one side. You can see here, again, from the dorsal aspect, you've seen a lot more of the groin, a lot more of the whole area, the reproductive area here, than you are here. You shouldn't be able to see so much of that. Why are you seeing that? Because the whole of the pelvis and the weight of the pelvis is shifting over that way. And that's why that bone is sticking out there. And of course, that's putting tremendous pressure into the ovary there. And you can see that it's caused the vein to be distended. I'm going to talk more about reading the venous system in a minute or two, but you can see that that is way out there. And, you know, if you weren't looking dorsally, that might not be quite so obvious. So always look dorsally. Here we go. These are just all over the place, these feet. I mean, that foot is, okay, that foot doesn't look too bad, but, you know, they're actually at a different height, so there's a problem there. This foot is far too upright. You know, it should be slightly, as I said earlier, it should be relaxed like that. So you got a lot of, I would imagine this person is aware, you know, when you've got something quite this extreme, the person probably is having back problems. But I'm just showing you what to look out for and how to work. Now this is showing you about the tilt, the pelvic tilt, anterior, posterior. When I first learned reflexology, I was taught that this area is the helper reflex to the uterus, and I never understood why until I started doing visual reflexology. Look how tight it is. It's not because it's coming off the end of the couch. It's just because it's super, super tight. And I'll show you the same foot from the front. Look, it's really, really coming straight in your face. You can barely see. You can barely see the reflexes. You can barely see the base of the feet. And that's, again, that's very emotional. That's a person, you know, all front. They're all front. Everything's fine. Underneath, what's going on? Don't know. But there's probably a lot of emotional stuff here. Very, very strong, very highly strung here. And this, again, you know, you're looking. So with this, you'd want to be doing lots of stretching, pulling it out. But in general, whenever you're looking at the musculoskeletal system, the technique you want to be using is very much about massaging, because that's how you would treat that system in the body. You wouldn't necessarily be doing endless finger walking. I'm not saying don't do your finger walking, of course do it, but if you want to really work on this kind of thing, you want to be massaging, much as you would massage the pelvis if you were giving the pelvis itself a massage, the muscles, because that's what we're looking at, the musculoskeletal system. Okay, so I think we're probably now, yes. This is still, we're talking about alignment here, but this looks like to me like the person, the lower back is very weak. When you're looking at the feet a lot, you probably get to see the difference between the feet that are being held with tension or the feet that are just flopping because they're weak. If you can't see it, then the minute you touch them, you'll be able to tell whether there's any resistance there or whether they're just kind of going like, ugh. This, of course, tells you a lot emotionally how the person's feeling. Are they feeling strong enough to, you know, support not just a pregnancy physically, but, you know, the whole emotional demands that's put on a woman when she's pregnant and has a newborn baby. Physically, it will mean, you know, the lower back and the pelvic floor and so on, the mid-spine muscles are weak, and she could do something herself to strengthen them. There's a lot of things she can do, exercise, Pilates, there's so many things you can do to strengthen them, but that could also be very useful. Now, this is something that I get asked about all the time, and very, very, very relevant to pregnancy, fertility. So we're still kind of on the musculoskeletal system, but looking at a slightly different indication of things being out of balance. These are called piezopedal papules, these little swellings. Now, of course, we don't diagnose. So if you're in any doubt at all, or even if you feel really clear, you know what they are, you can suggest that you know that they go for a medical diagnosis. Certainly if they hurt, then they should be checked out. But anyway, that aside, getting back to what they mean for us as reflexologists, they are in fact herniated fatty tissue in the feet. So what that means in terms of the reflex area of the body, because they're only ever found on the heels, they're found on the lateral and the medial edge of the heels, nowhere else to my knowledge. Herniation is a sign of weakness. So this is showing there's weakness in this area in the body, in the connective tissue of the area, the very lower back and the pelvic floor. And in the Facebook group that I run, time and time again, people have said, oh, there's a lot of these papules and the client's got endometriosis, she's got fibroids, similar sort of things to that. Is that what they signify? No, they don't signify that, but they signify something that might be contributing to those problems coming to be. And they obviously are, you know, big problems with fertility if you have either of those things, but it may not be those things. There may be any other things. But even if there's no diagnosed problems with that area, energetically they are a real barrier. You know, they're a form. You know, they're blocking the energy. You can see, you know, the dead into the area, the reflex area of the pelvic floor and the uterus, all those areas. They're really a kind of congestion, and a weakness that energetically is really not helping the area at all. So what you can do with this, again, a lot of this can be for the woman, to help strengthen the pelvic floor, strengthen the lower back. You will know your client, you will know what things to maybe suggest. You could also possibly suggest she looks into diet to help improve her connective tissue. That can make a big difference. Now, at this point, again, we're talking about referrals, because we're reflexologists, we're not nutritionists. So I would suggest that, again, you have in your address book, you have a good, well qualified nutritionist to refer to, somebody preferably who's specializes in fertility, because we all know, and I'm going to show you numerous examples of how important nutrition is for fertility. So this is another example. If she wants to improve her connective tissue, then it will help the pelvic floor, and it will certainly help with fertility. These are really seen very much in women who stand a lot, women who are overweight, women who possibly have had lots of previous pregnancies. Anything that's impacting on the pelvic floor, you tend to get women, they will appear. Also poor footwear. Women walk a lot in poor footwear, they become more noticeable. If a woman does become pregnant, they can become more noticeable because, again, of the weight on the pelvic floor. So this is what it's telling us. Now, if the woman does do something, if she loses weight or after the pregnancy, whatever, these very often recede because the connective tissue has become stronger. So I'm talking quite a lot about them, but you do see them a lot, and they're very, very important for fertility. And it's interesting because you see them on men, you even see them on children, but you see them much, 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 much more on women, much, much more. And I think that's, because of the way the female reproductive system is. So, okay, and here we're seeing them on the lateral edge, and this is around the ovary reflex. So, not great for the functioning of the ovary there either. Okay, moving on, I'm going to make this a little bigger, I think. Now we're kind of still looking a little bit at the, the musculoskeletal, the support system, but we're moving on a little bit now to looking at lines. Now, what I want you to see here, can you see there's like a little groove there? And that's caused by lines forming, lots of little lines forming this kind of groove to appear. And this is right beside an area of puffiness here. Now, I've had people often say to me, if this area here, which we tend to think of as the bladder, is the bladder full? No, it's not. It doesn't mean that at all. If you're seeing puffiness, and particularly if you're seeing it one side and not the other, that's showing you, again, it's the way that the pelvis is aligned, and there's a misalignment there, and it's causing this area to be thrust out more, to become more apparent. And certainly we're seeing there is a problem because of these lines here. Lines are developing there. Lines are always a sign of stress. They can be caused by many different forms of stress, but one of the main forms of stress is because there's a misalignment in the musculoskeletal system. You will get these grooves start to develop. In fact, other lines, indication of problems with the posterior anterior alignment, so the pelvic girdle, these lines here, and you can see they're much deeper on that side than they're on that side, and that's because the foot, I know she's sitting cross-legged here, but the foot is being pulled back and causing these lines to develop here. Okay, so more lines. You see the lines here coming down across the fallopian tubes, and there are little lines here actually right on the uterus reflex itself. These probably stress lines, and we've got stress lines here as well to do with pelvic alignment, but these are very, very small and narrow. That there's many, many different types of lines you see in the body, and often I'm not even sure myself what causes them, but I have to reiterate, they're always a sign of stress on the body. They're energetically, they're a barrier. They're an obstacle that the person's had to overcome energetically. So that's how to look upon them. And sometimes when you get these very small, narrow lines here, it can be a sign that there's been some kind of pathogenic overgrowth, so a bacterial infection, something like that. But I'll look at that a little bit more in a minute. But whenever you see lines, this is telling you there's stress to the area. And, I'm not going to keep going on about my book, but in my book, I look into lines. There's 2 whole chapters just on lines because there's so many lines. It's particularly with elderly people. It's like a map. It's like road map or line, pathways, roads, highways of everything the person has passed through. They're fascinating. Okay, again, we've got more here. We've got lines here. We've got these when the lines are very narrow like that, I tend to see that in people that are they're quite anxious. When they're very, very tiny, close together, and when you see them coming down, as you see here from the spine reflex, I tend to see it's somebody that the nervous system is under a lot of pressure. They're very anxious. But where you see the lines coming down here, it's to the bladder and the reproductive area. That's signifying to me that the person is very anxious about that part of their body. Here, I'll make that a little bit bigger. It's just the same thing, really. You've got quite a deep line that's coming down from the fallopian tube, but it's coming right into the ovary. Right into the ovary there. So there's obviously a lot of stress going into the ovary. So all these lines, they're just kind of telling you to pay more attention to the area and try and get more idea what is causing them. Because as I say, there'll be many different reasons for their cause, but they're all telling you that area is under stress. Whatever the cause, the area is under stress. Right, okay, now we're moving a little bit away from the pelvic girdle and the organs of reproduction because, of course, a lot of other things in the body are very important, particularly the endocrine glands. Now, I was taught that this area here is the pituitary reflex. I know a lot of people these days put it here, more anatomically correct, I suppose. And some people say this is the hypothalamus, etc., etc. I don't know, but in all my years of being a reflexologist, which is I don't know, nearly 3 decades now, I would have to absolutely say this is very, very important for the endocrine system. This reflex here, very, very important. And you can see here, can you see all these lines coming up? All these lines coming up and impacting on the area. You've got lines. It's not just people might, oh, is that from the sock? Is it? No, there's something going on here. You can see those little lines coming up these toes as well. So you've got a lot of stress, a lot of pressure. You would really want to be paying a lot of attention to the pituitary gland there. And okay, we've got, I will bring this up. Can I bring this up? Oh, it seems to have gone. The thing to bring it bigger. I don't know if you can, hopefully you can see this. There's a little line there. You will very often get lines coming from the spine. And that is telling you there's pressure on the spine, the vertebrae are being compressed. And why I've got this one here, sorry it's so small, this is coming out roughly where I would say one of the nerves that supplies the thyroid is coming out of in the spine, around C7. And this, I often see this in women are having problems, gynecological problems with their periods, because of course the importance of the thyroid gland in ovulation. But things like this to look out for as well. If you've got these lines coming out, and this is much more, when you're looking at visual reflexology for other problems, I talk about that a lot more, because all the way down the spine you will see lines coming out at various points, and that's telling you that those vertebrae are under pressure because the muscles are tight there. But that's definitely something to look out for if you see a little line there coming from round about where you'd see the nerve or one of the nerves supplying the thyroid. Okay, I don't know why this is not letting me come up any bigger now. Sorry about that. I hope these are big enough for you to see. Can you see here on the plantar thyroid? You see all these lines running down there. Not really so noticeable there, but certainly here, all these lines coming down there. So that is telling me straight away, oh, I'm going to ask the woman about all sorts of questions about anything that I think might show me there's an indication of thyroid problems, because a lot of women have thyroid problems, they're not even aware. So something like that, seeing all those lines go down there over the plantar thyroid, would certainly lead me to ask questions about that. And again, as I mentioned earlier, because of the importance of the thyroid in ovulation. Okay, right there. Now, here we've got lots and lots of lines all over the feet, just all over the feet. And you will see that, but that's telling you this person is dehydrated. the lines aren't caused by dehydration, they just become a lot more visible. You know, we've all got, just from when we're in the uterus, we've got lines develop on our feet, but they become a lot more evident when the cells shrink because there's not adequate water in them. And so you will see this kind of thing, multiple lines all over the feet. That's really important if the person's dehydrated, because it affects the endometrium, it affects the cervical mucus, it affects all manner of things. But if you're seeing that, then you do want to really have a word with the client, and you know, obvious things that I'm sure you're all already aware of. Diet as well. You know, people get a lot of fluid from their diet if they're eating lots of fruit and veg as opposed to lots of heavily processed food. So yeah, you could certainly talk to them about hydration when you're seeing multiple lines like that. Now we are moving a little bit onto nutrition now. A little bit more. These are multiple lines all over, particularly over the small intestine. And again, as I mentioned a little bit earlier, when you've got lots of lines, you see these crisscross lines here, a lot of them are parallel, running parallel, as you see here. This is thought to be show an indication of overgrowth of pathogens. So it could be parasites, could be bacteria, could be virus, but you tend to see this mostly over the digestive tract. And it's quite interesting because when you see this, a person may not have symptoms. Very often I've seen this kind of thing and other textures over the small intestine, and the woman is not aware of anything, because the small intestine really, because of the way it functions, it tends to impact on other areas of the body, as opposed to, say, the stomach, which has got very clear symptoms, or the colon, very clear symptoms. The small intestine, very often the woman's not aware of the impact it's having on other aspects of the body's health. But as you know, we're talking about now how important it is for reproduction, for the digestive system to be functioning well. This certainly, seeing this kind of thing, it certainly doesn't look very healthy. And if you go in there and you palpate it, I can pretty much assure that even if the woman says she's not aware of any problems, it's going to feel tender. So that's really important to look out for that kind of thing as well. Here we are now. Again, you've got lots more of these kind of textures happening all over the reproductive areas. Again, it's telling you there's been a lot of issues there. But what I want you to look at on this slide, I really would like to make these bigger, but I don't want to lose I don't want to lose everything. Hopefully, as I keep saying, this is big enough. Can you see here? There's a swelling. It's sort of slightly red and swollen. This is right on, if you follow the colon round, this is right on the splenic flexure. And when you start looking at the feet, and particularly looking at photos of feet, you will see this a lot. I mean, when I palpate the colon, I'm always able to feel when it's impacted. I mean, you can feel it's harder, you can feel, you know, and it tends to be a lot of the time around the flexures where it bends. It's difficult for the waste matter to pass through. So this is telling you, oh, there's a problem with the digestion here. And of course, we're talking about the digestion and reproductive system, but there's an added problem when you're seeing this. Why? Because anatomically in the body, the ovaries really are actually not that far away from the colon, and certainly they're not that far away from the flexure. So if you've got in the body the ovaries coming up, you know, to around about this area, if you've got a lot of impacted waste in the colon, around the flexures and around also, you know, the ascending and descending, but particularly around this area here is really compacted. That really impacts on the functioning of the ovaries. It is just much harder for them to release the egg because it's just too much compaction there and too much congestion. Energetically, there's just a lot of congestion, but just physically, it does impact on the ovaries' ability to release the egg. So you want to be working a lot on that. And again, you know, you can give general advice on nutrition, but if you feel it's a problem, you know, don't go beyond what you're trained to do. Refer. Seeing it again here. I mean, here again, you know, you've got quite a lot of lines. This person is quite dehydrated. Also, sometimes what you get alongside, and I think it was the other slide I showed you before with the lines, maybe it was clearer there, you often get a sort of slightly chalky texture. And that is another indication, as maybe you can see around here, of may well be essential fatty acids. That is classical, or a classic example of the skin showing problems with nutritional deficiencies. And sometimes so you will talk to a woman and she'll say, oh yes, I eat plenty of nuts and avocados, blah blah blah. But what it can mean is the body's not absorbing those nutrients. So always bear that in mind, that the intestines, the digestive system may need a lot more support to actually absorb, even if the woman is eating healthily. That's why it's important for us as reflexologists to continue, even if they're going to see a nutritionist and changing their diet. The nutritionist is not necessarily going to be able to help in the same ways we are to help encourage the digestive system to function properly. But what you've got here again, can you see that swelling there? Again, you've got compacted waste there in the splenic flexure. Sometimes you see it there, sometimes you see it in different parts of the foot, but there's another example. Okay, now talking about how the skin and the skin cells reflect the health of the digestive system. Here you've got, this looks like athlete's foot. Yeah, I'm not going to talk about whether treating it or not treating it, but it's definitely telling you there's a problem. And if it's athlete's foot is peeling, then that is definitely a problem that is being caused by possibly candida overgrowth, something like that. But again, I would be thinking very much about nutrition when you're seeing that kind of thing. But with a visual, if you're seeing this, maybe if you were not, decided not to treat, you're not really going to get how all this feels. But if you then went on to treat the hands, from seeing this, to pay more attention to the equivalent area in the hands, because you've already seen where the problem is affecting the person. Now here we've got again another skin conditions. Looks like it's sort of eczema or psoriasis. Now, where it's not just the skin condition tells you something emotionally. Here we've got a lot of inflammation. It's kind of red raw, so the emotions are very raw. If it is if the cells are changing too quickly, and that's why you're getting this raw, you're not, the deeper cells are not getting a chance to form properly. So this shows the person this changes are happening too quickly in the person's life, and they're feeling quite raw and open and vulnerable, but they're also feeling angry about it. So that can be very relevant from the emotional perspective. The woman might feel she's maybe just a suggestion, being pushed into having another baby too quickly, or something like that, or she's not ready in her relationship. But what is important here also is that it's really getting very close to the uterus reflex, this problem, because where you see the skin condition, it's not just what the skin condition is telling you about the digestive system, and in this case the autoimmune system. It's also telling you what areas of the body are being impacted by that imbalance. And here we can see, as is quite common with digestive issues, it is impacting directly on the intestines, but here it's also starting to come down and impact towards, the fallopian tube and the uterus. So that's very important. Again, whether you would treat this or not, you could treat the hands and you would work the equivalent reflexes in the hands. So, okay, here now moving on slightly, but I just want to say there's another example of some, the skin there's very red, very inflamed, and coming very close to the ovary. But what we've got here, we're looking a bit more, we're going to look a bit more now at texture, and there's lots of things going on here. You can see these stress lines coming down into the ovary, inflammation, all sorts of things going on. But what I want to look at particularly with this slide are the underlying texture. So this is not the skin so much as the tissue, the underlying tissue. Now, we're all very aware of looking at the lymphatic system, and of course, one of the areas the lymphatic system may well get puffy is over the fallopian tube, so we would all be looking for that. But what people are not really so aware of is there's very often lymphatic congestion coming up behind the ovary. This is very common, not just when a woman's having difficulty conceiving or whatever, but also when there's any kind of gynecological problems, you get a buildup of lymph, and it's very easy to miss if you're not looking, or if you don't look for it. But very often it's there, and that's telling you there's a buildup in the lymph. The lymph is pooling there. It's not coping. It's not clearing the toxicity out of the system. So you can see that there. And obviously with that there and the lines coming, as I said earlier, there's lines here. There's multiple causes in many situations why the woman can't conceive. It's not just one. But I do want to draw your attention to this swelling here. Now, this is the kind of thing, again, you see a lot in women. Sorry, I have to plug my computer in. Okay, back now. And this kind of, you don't really see it so much in men. And I wasn't really sure what it related to because it's a very different texture. I think I sort of probably assumed it was just lymph pooling. But when you go in and feel it, it's a very different texture. It's much more solid. It's almost like jelly, but it's a sort of firm. It's much firmer than lymph, and it tends to pool in this particular area here. And I asked a friend of mine, a colleague who's a podiatrist, and I said, do you know what it is? From a medical perspective, what is this? I mean, I have this swelling, but practically all my clients, well, not all of them, but a large percentage of my clients over a certain age that are female have this swelling. And what is it? What's it about? And she just didn't know. She's also a reflexologist, and I don't know what it is. My conclusion is I think it relates to cellulite, because it's one of those things that seems to develop around times of hormonal changes. It will develop or get bigger around menopause, or a woman gets pregnant, or maybe even it may start in some women as early as puberty. I don't know, but I think, and because of the position where it is, although it's not directly on the hips, it is in, I was actually taught that this reflex relates to the sacroiliac joint. So if you came through, again, I was talking about before, if you're looking dorsal plantar wise, you would be kind of looking into the sort of around the area of the hips and the buttocks, where there is a lot of cellulite. So from a reflexology perspective, is also, it's not great because you've got the egg is trying to, you've got the fallopian tube it's on top of. It's a kind of a bit of a barrier to movement of energy. Although, once women have got cellulite, it's very difficult to get rid of. But it's just interesting to think about what that is. And it certainly shows that maybe the woman has had a period in her life where she's had a hormonal change that she hasn't adjusted to very well. Okay, right. Here it is again. Just, very common, very, very common. Okay, now we're talking about underlying swelling tissue. This is important. A lot of people do not know about this. This is something called lymphedema. It's not edema. This is different to edema. It's not lymph swelling. It's a different kind of swelling. And a lot of reflexologists don't know about this. Even a lot of medical professionals don't know about this. But it's actually this happens almost exclusively with women. You can see if it happens bilaterally, it's certainly not lymph swelling, because lymph would be on both feet. And it happens when there's been hormonal changes in the body, and that would tell us it's the woman's not adjusted very well to those hormonal changes. Very important for fertility, but it's also just good to know the difference and not just assume, and not just be plowing away trying to work the lymph thinking, oh, I'm going to help with this, with this fallopian tube, blah blah, because it's a totally different thing. I would advise, if you don't really know anything about lymphedema, to look it up, because it's too long involved for me to go into here. But it is something that we should know more about, and know the difference between that and just a lymphatic drainage, which you can really help with, and is really important for women, especially for the fallopian tube area. So just to know the difference between those. Okay, now we're still on underlying tissue, but we're kind of coming back up to what I was talking about before, pituitary, hypothalamus. Can you see that swelling there? Anytime you're seeing a swelling on a gland, it shows a surfeit, it shows an excess. This gland is overactive, it's producing too much. You don't want to see that. There's too much going on there. And you would know straight away that she needs a lot of endocrine balancing. So you would work on the other endocrine glands as well as this. You can see it here again. Here, there's actually on the little toes as well. I talk more about why the swellings appear on the little toes as well in more detail when I've got more time. I haven't really got time, I don't think, now to go into that. But if you're seeing that there's problems all throughout the brain, and certainly you want to work all the pads there, and particularly the pituitary. Now we're seeing the opposite. We're seeing a depletion. I hope this is clear to you. It's not a great photo. Unfortunately, I must try and get a better one. But can you see there's little dips there? And here, there's a dip. So instead of that kind of pronounced swelling we had earlier over the pituitary and the sinus, the pads of the toes, we've got a depletion. So that means that, you know, there's a real lack of energy going into the area, but this will also impact the balance of the hormones. Maybe there's a lack of certain hormones, but there's certainly a lack of energy going into the pituitary, hypothalamus, and the brain generally. So for the endocrine system, this is very important. There's a lack there. This woman actually was, I mean, conversely, she was actually having a hot flush because she was menopausal, but it doesn't matter. It's just to illustrate the point. You will see this in women that are, you know, all stages of their reproductive life. Okay, now we've got a different kind of, you see here the swelling again, you will see it a lot, but here we've got a swelling pretty much over, more or less over where the adrenal gland is. I don't know, some people might put it a bit higher, but it's certainly telling us, let's pay a bit more attention here. There's some swelling over the kidney, but in this case, we're talking about the endocrine system. So it's definitely telling me, pay a bit more attention. And when you start looking, you actually see this little swelling over this area of the foot. It's quite common. I wouldn't say it's a cyst. You know, you have to be sure these things aren't cysts, but I wouldn't say it's a cyst. It's just a little swelling. But again, you see it in people where the adrenal glands being really overactive, hyperactive. You know, they've been incredibly stressed, they've been living off adrenaline, all those kind of things. Of course, that is really very, very bad if a woman's trying to conceive, because the body is not likely to conceive when it considers it's in crisis mode, which it will consider if there's an excess of adrenaline going around the system. So, oh yeah, here again, you know, we're looking at underlying tissue. Here we're looking, can you see the swelling over the liver area? Now I'm putting this in with the endocrine system because, you know, the liver is also involved in, you know, hormonal function. So if you see that kind of thing going on, there may be issues going on with the digestion, which is still relevant, but also with the endocrine function. So you might not know exactly with the liver what it is because it's got so many functions, but look out for that. Look out for that swelling, and you want to be working on that. Again, there's not necessarily a surfeit in so much as there's an excess. So it's congestion, and that's an excess that's causing congestion. Depending on the organ, you know, a surfeit will come up in different ways, but there is with the liver. And once you start looking at photos, you'll see this kind of thing. You know, I'm not showing you, these slides are nothing special, really, they're nothing special. Once you start looking at more and more feet, you will see these patterns start to emerge very clearly, and they're very common. And these are just very ordinary feet. There's nothing, you know, these people didn't have particular feet conditions or, you know, any strange illnesses. Very normal feet I'm showing you here. This is very common. You see, you know, the dryness around the heels. Why this is important for the reproductive situation is when it's very bad like this, it can actually be a clinical sign of a thyroid problem, hypothyroid. So, you know, ask all the relevant questions for that. If there's any medical history in the family, if the woman's put on a lot of weight, etc., etc. But from a reflex perspective, this dryness is showing an inadequate supply of moisture to the area. What's that mean? An inadequate supply of lymph. So The heels are the gluteal muscles, the pelvis. This is showing an adequate supply of lymph to the pelvic and the gluteal area. And you see that other parts of the feet as well, but it's very relevant in this case. Now, I know you're probably thinking, oh, but what about puffiness? You know, you were just talking about puffiness in the lymph. There's lymph. You can have both. You can have a swelling of lymph because the lymph isn't draining properly. It's pooling because there's a bit of congestion. But at the same time, there can be the supply of lymph to that area can be very poor, and there can be a lot of dehydration in the area, which we're seeing there. You will see the dryness will tend to be on the soles and on the edges of the foot for reasons, again, it's a bit too long to go into, and the lymph will pool on the top. But this is an indication of inadequate hydration, and therefore, because lymph is almost all water, this will show there's an inadequate supply of lymph. Here we've got seed corns. These little tiny little dots, you see them very commonly over the heel, the pelvic area. Again, this is showing a problem with the lymph flow. Yeah, that's what's thought to cause them, the sweat ducts in the feet. So you would say there's problem sweat, lymph, fluid. Again, there's a problem here that is impacting, I would say, on the lymphatic system. So, okay, nice verruca for you. This is on what many people see as some people see it as the direct ovary reflex. Some people see it as a helper reflex. Some people aren't taught it's a reflex to the ovary at all. But I would say anatomically it makes sense that there is a reflex, whether it's helper or direct to the ovary, roughly in this part. I mean, it may be a bit lower. I mean, you know, it's not, the ovaries aren't fixed anyway, but it's very common actually to see problems on this part of the heel because of the structure of the heel. I won't go into that now, but the verruca is right on or just very near where the ovary helper reflex would be. Verrucas, as I said before, why is the verruca there? Why is it not somewhere else? What's it telling us? Verrucas are very deep, very ingrained problems. As they are physically, they go very deep, very, very deep. This is quite a big one. Often they're much, much smaller than this. Sometimes the client doesn't even know they've got them, but because they're deep, they're buried. Sometimes they don't trouble the client. This one may well do, but a lot of the time they don't even trouble the client. So again, you know, you take a very literal interpretation of that as to what's happening in the body. There's a very deep, buried, long-held problem that may not trouble the client at all, but when there's some sort of crisis, it may flare up and then start to cause problems, which is what happens with verrucas. Sometimes they start to cause pain and problems depending on the other things that are happening in the area. But emotionally, it's also, verrucas are seen as a very deep, buried problem. You know, the ones you put the back of your mind and you try and forget all about, but it's still there, it's still in your subconscious, it's still affecting you, it's still impacting you. So that's the thing with verrucas. It may be on a reflex. Very often is that the person says, no, I've got no problem with that. You know, I've got no problem with my digestion. I've got no problem with my ovary, blah, blah, blah. But it's a deep buried problem that they may not be aware they have because it may be asymptomatic, but it's still there. And it's shown an area of weakness because the virus enters, the verruca virus enters a part of the foot where the immune system is weak. So it's telling us that the immune system there is probably weaker than in another part of the body. So that's what verrucas are telling us. And as I say, again, emotionally, it would be to do something very emotionally connected to that area that we've tried to suppress and bury. Right, okay. Now, hard skin here. Hard skin, right? Okay, very, very important. Why? Because it's on the area of the brain that relates to the cerebellum. It's the area of the brain nearby where the nerves cross over from the brain to the other side of the body. It's also the start of the spine. So energetically, it's the connection between the mind and the body, as of course the cerebellum is, you know, putting thoughts into action. If you've got hard skin here, this is telling you there is a real shield, there's a real barrier there's a real disconnect between the mind and the body. And that is very, very important if the woman's wanting to conceive. Obviously, her thoughts have got to be put into action, i.e. her thoughts of wanting a baby have got to be put into action. She has to, you know, physically conceive. She can't just think about wanting to conceive. This is showing there is a real problem there. There's something is stopping the energy flow between the mind and the body. Now, I'm not saying a woman with this is not going to conceive. You know, as I keep saying, it may just be one contributing factor, but it's worth considering and it's worth looking into. And here we've got a similar thing. We've got two toes, but you can see just through there the hard skin. The hard skin's built up as it tends to do because the angle of the toes are going off at this angle. It's showing you the neck problems, which I'm not going to go into now. It's not quite so relevant at the moment, but this is the hard skin tends to build up because it's rubbing against the shoe, because the neck is the big toe, i.e. the neck here, and the head is misaligned. But there you see, energetically, you see one lobe of the brain's going that way, the other lobe's going that way. And this showing, you know, emotionally, there's indecision. There's like not connected. The two sides, the two lobes of the brain are very separate. But the hard skin there, again, as I mentioned, putting thoughts into action. Energetically, there's a barrier. There's a shield there. What is happening there? Why is she, you know, why is she not connecting? Why is her mind and her body not connecting as well as they should? Okay, right. Now we've got some hard skin here, but we're going to start talking a little bit more about color. This is quite yellow, you know, it looks like dry, hard yellow. Again, as I keep saying, you know, you're talking about the pelvic area, you're talking about the groin, you've got dehydration here, so you've also got the yellowness. Now, when there's dry skin, you very, very often see yellowness, and yellowness is toxicity. It's showing there's a buildup of toxins in the area. And when we see this happen, it's obviously not a great sign. This yellowness doesn't tend to go round so much straight into the uterus area. But if it did, maybe I could get another slide that did, because very often it does. When you're seeing yellowness where it's over a mucous membrane, which we have, you know, at the cervical mucus, for example, this is really important because it's telling us, you know, the mucus is becoming too dry and it's also becoming too thick and claggy. It's not a nice, healthy consistency. So that's really important to look out for, particularly if it would kind of around this area. But also you've got some inflammation here. You can get more than one color over an area, which you certainly have here. And then often you'll end up with a mix, you know, it sort of it becomes orange. The color actually becomes orange where the two colors combine. But I've mentioned inflammation already. There's inflammation in the cells. You don't want that. You know, we know more and more everything to do with the physical body. Inflammation, it contributes to virtually every single health problem. It exacerbates it. So we do not want to see inflammation. We don't want to see it around this area of the body because it's really not conducive to the woman conceiving and carrying to term. So always look out for redness, always look out for yellowness. Of course, always look out as well if the area is very pale, because that means, you know, the blood supply to the area is not great. And if there's a bluish tinge, also incidentally, it means that the blood that is getting there is poorly oxygenated. So it's not just about the feet, not just about the feet themselves. If there's problems with the circulation at a reflex area, that means there's problems with that area in the body with the circulation as well. Okay, so we got a really good example of inflammation here. It's going all the way up the spine. It's certainly impacting coming up towards the reproductive area. And incidentally, you know, this person has got a lot of melanin in the skin. It doesn't matter. It doesn't matter what ethnic background the person's from. You will still see the underlying skin tones will still be the same. You will still see inflammation. You'll still see toxicity on certainly on the soles of the feet. It'll be very clear. But you don't want to see that. You can see straight away that's not healthy. This is what I mean about, she could come back the following week, that's died down as a result of your treatment. You see straight away, oh, great, oh, where's all the inflammation gone? You're not necessarily going to get that from what you're feeling. If the area is hot because there's a chronic infection, for example, then yeah, you would feel that. But if the inflammation is chronic rather than, acute, if there's an inflammation that's acute, you would feel it. But if it's chronic, if it's long term, you would not necessarily feel it at all, but you will certainly see it. So, okay. Now, we're coming up, this is the chest and heart area. Now, you might think this is not directly anything to do with the physical reproductive system. It's not, but just from a holistic point of view, this is important. This is the chest and the heart area. What's happening here? There's a lot of inflammation, and it looks almost quite red raw. There, it looks yellow. So if you're working holistically, if you're seeing this in this area, you would really be wondering what's going on emotionally with the person. Is, her emotional weight on her chest, it's too heavy, she's got inflamed emotions. The heart area, there's toxicity there as well. Maybe there's a callus building up there. Is she putting a shield over her emotions? Seeing this kind of thing, although it's not directly related to the reproductive system or the endocrine system, I would say these are markers that you really want to find out what's going on emotionally with this person, because this may well be, a major cause of her not conceiving that is impacting on other areas of the body as well, her emotions that are coming from this. Okay, now we're looking at the venous system. Can you see here? Very, very obvious here. Lots of the very clear veins, broken capillaries. As I mentioned earlier, if there's been trauma to the lower back, the uterus area, you will see a lot of broken capillaries. When you see broken capillaries, they are showing you there's been trauma to the venous system, and that will be leading you to ask more questions. Has there been any kind of incidents there that may have led to this happening? But even if the woman say no, everything's fine, it's certainly telling you you need to work on that area. You need to really hopefully make those veins less evident, make them a little bit less close to the surface. When a woman conceives and she carries on her pregnancy, it becomes more obvious, but that's not what we're talking about. We're talking pre-conception. You don't want to be seeing that. Doesn't look too healthy at all. And we've got another indication here. Can you see how distended all these veins here? And you know what I was saying before about the bluish tinge? You get this bluish tinge when the blood is very poorly oxygenated. So poor circulation, problems with the venous system, but also poorly oxygenated. And the venous system, emotion has to do with the flow of life. Is everything flowing? Is everything, moving smoothly? Or is everything, the kind of constantly kind of stops and starts, and things that are stopping things moving forward, flowing properly? Okay,
Sorry,
you've got
Angela, sorry, Angela. I just want to let you know that we've 20 minutes left,
yeah,
just a little over 20 minutes. So if anybody has any questions that they want to ask Angela, this would be a good time to start putting it into the chat box. So the questions are there ready for, okay? Sorry, Angela.
Okay, thanks, Katrina. Yeah, we're coming to the end, soon. You can see the broken capillary there directly on the ovary. So something has happened there. Okay, more broken veins. I think we've covered that. I'll probably speed up a little bit now. This, unfortunately, I'd really like to make this larger. I don't know, can you see, they were talking about freckles now. Can you see freckles? There's a couple of freckles here. Freckles are markers, as far as I can work out, where there's been trauma to the nervous system. I've only reached that conclusion because of doing linking on them, because I didn't really know why they developed. But I've done this a lot in workshops. I've done this a lot with clients, and I will just touch them. And if possible, I will link maybe with the plantar. I mean, here it would be a bit difficult, but very often you will get a very fast reaction. The person will immediately feel instantaneous relief. They will feel relaxation. They will feel tingling going up the body. Certainly something that is to do with the nervous system. And when I looked into the clinical reasons why freckles develop, there's not been a lot of research done into them, but it may well be to do with something to do. The melanin has been affected by trauma to the nerves, but that's as far as I've got, and I've done a lot of research. But you know, they're seen as harmless. Nobody really cares much about them. So even medically, there's not much information there. But as a reflexologist, I want to know, why are they there? And as I say, you know, I found a lot of very interesting results palpating them and then just holding them, linking them. Hopefully you've all learned about linking. But this was very interesting, this client, because she had IVF, and it had taken, the pregnancy had started, but then she'd miscarried. And I hadn't seen her for a while. She came to me after the miscarriage, and these 2 freckles had appeared. She'd not been sunbathing at all. You can see the rest of her feet very pale. You know, last thing she wanted to do. In fact, I think it was in the autumn, but she'd not been in the sun at all, and the freckles had appeared. And I've seen that a lot. I've seen freckles just appear out of the blue. And I know they're seen as, oh, sunbathing. No, but again, why in one part of the foot and not in another? So this is one of the things, you know, I look to the wider community. If anybody's got any opinions on this, anybody ideas, can illuminate me. But I'm very curious to freckles. And they develop where they develop on that reflex for a reason. And for me, I thought it was particularly interesting in this case because she had miscarried. There's also a mark there. You often get a little mark in an area where there's been an injection, and that's showing the trauma to the area in the body. And this was the abdominal area, and she'd had an injection there as part of her, you know, recovery process from and to do with the IVF. Okay, I think here's a mark again, right on that area, roughly where you might find the plantar helper reflex to the ovary. Here, this is just going down a zone. You know, if you're seeing this, think about the zone going down to the ovary. Is there anything happening here that is going down the zone that may be impacting? Moving on. The nails are very important. I don't really cover the nails a lot because the nails are kind of clinical things that we can learn about from a clinical perspective, but they are very important. Have a look at them. If they're poor condition, they're often telling us about the state of other organs, digestive organs or organs of excretion, so on and so forth. So it's really good to educate ourselves. This nail here, the nail itself actually doesn't look too unhealthy, but again, I would be interested in going down this zone and maybe going down to the fallopian tube and seeing if there was any problem there. Okay, so I think really now I've just got a few more minutes. I think I'm going to give about 15 minutes or so for whatever. I just wanted to do, I've got a few of these. I think I'll just do one where I'm looking at multiple incidences of things that could cause barriers to a woman conceiving. So I don't want to confuse you. This is the sock. The sock has been pulled down to here to show the ankle, the heel in its splendor. So what have we got here? We've got lots of things showing problems. We've got multiple pisogenic papules here. We've got lots of inflammation. We've got toxicity, lots of yellow hard skin. We've got the cracks starting to form here, showing there's very poor hydration in the area, probably impacting the lymphatic system. We've got these stress lines here. We've got a tiny little freckle here that's coming down towards the ovary. We've got distended veins. We've got lines coming in here. In fact, the uterus itself almost looks quite sunken. So quite honestly, if I saw somebody like this, I would be surprised if they didn't have problems with their reproductive system, because there's so much going on that is so out of balance. I'm going to do one more, then I think that's it. Okay, again, you know, similar things really, but she's got a little freckle here, which is on the what I was taught, the uterus helper reflex, and is to do with the sway of the pelvis, the anterior posterior pelvis. Very, very common in people that have lower back problems to find a little freckle there. Really, really common. Start looking out for it. You will see it. Lower back problems. And this is the sciatic uppermost sciatic reflex, but she's also got, you know, pisogenic. She's a very slim lady, but she stood a lot because she was a barrister. She stood a lot in court. She's got problems there. The veins bluish. She's got the yellowness there. She's got lots of things going on. But an extra thing I want to say about this, she had a lot of problems conceiving with her first child, and unfortunately he was born prematurely with multiple learning difficulties. And it's interesting to see here the area where when the cervix expands, it does come up towards the area where the we'd think of as the bladder, and you can see, oh, this looks quite traumatized. There's a lot of stress lines here. And she was trying to conceive again, and she was having problems again. But I did wonder, how much the trauma, the memory of everything that had happened with her first child was impacting on her. So yeah, I think I've covered everything that I tried to cover and fit in. There, honestly, there is so much more. I can't, I cannot begin in this limited short space of time to even within this aspect, even within fertility, there are so many more things I could have talked about, really, so many more. But I hope I've given you an idea. I hope I've put the idea in your head. This is how we can look at the feet, and this is how I myself can look at the feet. It's not just, oh, Angela Telford says this, Angela Telford says that. I'm not teaching you anything by rote. You learn these ways of looking at the feet. Train your eyes. It's such an amazing addition to anyone's practice. So, okay, I think that's it. We've got a little bit of time now for questions. So, Katrina, if you can put some questions.
Okay, so does anybody have any questions for us?
No questions. Well, either that means I've explained everything.
I think that means,
so
Angela,
clearly.
as always, you've given a jam-packed, fascinating presentation. Just you barely took a breath. So people always get value from your presentations. I know that because I've taken your class before. So much information there. And I think it doesn't matter how much experience you have as a therapist. A lot of this visual reflexology, it's not covered in our basic training so much. A little bit more now, but it's fascinating. And you've such a great insight. And you've such a great eye.
Right.
Absolutely brilliant.
I think the thing is, I think because I give so much information, maybe that's why people be a little overwhelmed, I think can happen. But, you've all got this on replay, and I hope you've I hope you've all found it interesting to have another look at and go through, and you can speed it up and fast forward. And yeah, come and join the Facebook group. And oh, I know, yeah, I did actually want to. I have one thing. I always forget. I'm such a bad businesswoman being a therapist. Terrible. Here we are. It's the book. Okay, there's the book. And also, this will be in your recording. You don't have to take a note. If you're interested in the book, there's the just put that in your browser, it'll come up. And this is the website. And in the website, there's also going to be information about the blog. That's not quite out yet, but it will be out very soon. Information how to get onto the blog, which is going to be free. That's free for everybody. And that's going to be about visual reflexology about once a month. And also, as I said, the Facebook group, if you go onto the website, that tells you how to go onto the Facebook group. And yeah, just explore it for yourself. Just start looking at the feet and taking photos, and it's amazing how much more information you will get. It doesn't always make sense. It doesn't always fit in with what the clients told you, but that is the same as palpation. So much of the time, palpation doesn't fit in with what the clients told you. It doesn't matter. The feet never lie. That's what Eunice Ingham said, and she was right. They never lie. And it's the same with the visual. The visual never lies. We might not understand why it's showing what it's showing, but there's a reason for it. And that's what we need to find out, and we need to work with. So yeah, I just tried to get everybody else a little bit as enthusiastic as I am about looking at the feet and reading them, because it's fascinating. It's like a painting. It's like a painting of the person's life in front of you. So I don't know. Any questions yet? Katrina, have you got a question?
I don't have any questions, but I just wanted to add as well about the book that there's lots of technique. It's not just about visual reflexology. You've lots of techniques in there as well. There's lots of lovely little videos as well, which is great.
Yes. Oh, I should have mentioned actually that on Friday, I have got a half-hour presentation about the book. So I will be talking a lot more about what's in it, because as you mentioned, it's interactive. It is actually, I have to make this clear, it is at this point in time only an ebook. There will be a physical book coming up, hopefully next year. But I really like the idea of an ebook because, you know, you can have unlimited color photos. You're not restrained cost-wise. And also, as Katrina mentioned, there's lots of technique videos based on what are you seeing, use this technique. So there's lots of that. Also loads and loads of links to a multitude of things that you wouldn't even necessarily consider or to do with the visual. For example, I mean, I've got a link. There's a teacher, Lorraine Senior, and she teaches work with children who are neurodivergent and or learning difficulties. And a lot of them are nonverbal or can't communicate very well. And obviously reading the feet is a massive boon if you're working with anybody. I didn't mention this earlier. If you're working with people that are nonverbal or who can't communicate because they're not well enough to or whatever. But, you know, I put a link into her because it's a great to be able to do that. I can mention that and I can say, oh, if you've got nonverbal clients or you work with, but then maybe I know when I've read books myself, I'm thinking, oh, that's interesting. I'd love to work with children who are neurodivergent. How do I find out how to do that? You know, oh, how do I find this reflexology teacher? So it's great to put in that link so you can link straight to that teacher. And I've done that a lot. So it's not purely, this is visual reflexology. That's maybe another thing I should have said, the difference with this and foot reading. Visual reflexology is about putting foot reading within the broader context of our profession. So that example I just gave, you know, it leads us to other things. If it leads us to develop our interest in other things, and one chapter in the book actually is about reading the meridians, which, as I specifically said, I don't do. You know, I don't. Chinese medicine is not my thing, so I don't do foot reading through Chinese medicine. But I got Chi medics who really that is their thing. They do meridians to write a chapter because they are highly, you know, they spent decades studying reflexology, Chinese reflexology. I got them to read the feet through the meridians, and it was absolutely fascinating. And they wrote a chapter of the book, and then I wrote the end of the chapter. It was so interesting because we both reached the same conclusions, just from totally different ways of reading the feet, and it was great to do that. So, you know, got that as well. You've got yeah, it's just bringing it all into the broader profession. So that's what the book's about. But yeah, I'm gonna do a presentation on the book on Friday if you feel you need to know any more about it. So yeah, great.
Just some lovely comments, Angela, to say that everybody's enjoyed the presentation. Lots of great information. Ebook is very good. Thank you. Very interesting and useful information. Thank you so much, Angela. Yes, I think that everybody's just, like I said, needs to process all the information.
Yeah.
It's a lot.
It's a lot.
Yeah.
It's a lot. It's
Yeah.
a lot. I just was panicking. I wouldn't have enough. I always do that. I panic. I don't have enough, and then I talk 90 miles an hour. But like I said, there's so much to fit in, and I always just finish these thinking, oh, I've missed that. I've missed that. Oh God, I missed that. So
yeah, no, as always, you're very generous with your knowledge, Angela. Thank you. I think if nobody has any other questions, we can close, and the recording will be available afterwards. I think Lisa's going to send the link to everybody after, so you can watch over again. Any final questions before we finish up?
okay. All right. Well, thank you
No,
all.
I don't think so. Well, thank you so much, Angela.
Yeah. And thank you, Katrina, for hosting. And thank you, Liza. I think it's Liza. I called you Lisa before. Is it Liza? I think it's Liza. Thank you, Liza.
No, it's Lisa. Thanks. Thank you very much,
Lisa.
Angela. It was a very interesting
Lisa.
presentation.
Right. Okay, great. Right. Well, I'll say bye to everybody now and see you again sometime, I hope. Okay. Bye. Bye-bye.
Thanks, everybody. Good night.
Good night. Good night.